finding a mentor can be quite tricky, and it gets even trickier when you're trying to find a mentor who looks like you, who has shared some of your experiences, and has a similar background or outlook to you. We found that many people from the Black community in particular find that hard. And what we want to do today is to talk about that, talk about some of the ways we can overcome that, talk about how we can bridge the gap between our senior health professionals and our junior health professionals, senior doctors and junior doctors. And what we have to do that for us this evening, we have 4 exciting speakers, and we have one of our junior doctors who's going to do quite a lot of reflection with us. So we hope that when you leave here this evening, you will leave with your desire to mentor or to have a mentee, or to just really think about what you can do to support the growth and development using mentoring as a tool. Before I introduce the speakers, I will just give a bit of housekeeping. You will notice that we are recording this event, so it's being recorded. So think about, if you have your video on, just keep that at the back of your mind. We have a question and answer function. Please feel free to use the question and answer function, because as you know, today is all about sharing experiences, asking questions, getting some learning, and taking some take-home messages away from here. We also have a chat function, and I would encourage you, wherever you're from, a junior doctor, a health professional, a senior health professional, feel free to use the chat function, because we do want to get a bit of networking going. So introduce yourselves. If somebody said something that's interesting to you, use the chat function, and we will be keeping an eye on that as well. And finally, we have a poll, and the poll is this is the first of many series we hope. We hope to end up with a really fantastic mentoring myriad, and we hope this is the first of many series. So we will be asking you a few questions in the poll just to help guide us, to get some of your views, and to see how we can take this forward together. So at the end of it, we will have a thriving mentoring community of practice. We will have clear standards, and we will have a chance to think about what we all want to get out of mentoring. I will now introduce my speakers, just tell you who they are before I hand over to them. We have Mr. Russell Amperfil, who's going to talk about to mentor or not to mentor. Russell is he's the Director of Examinations, Education and Training at the Royal College of Anaesthetists. We have Mr. Chim Olugu, who is an award-winning pharmacist, a public health pharmacist, and he's also a writer. We have Dr. Shade Adeneko. I'll tell you a bit more about her later. And we also have Dr. Ola Oladubewo, and we have Dr. David Baluyi. So as you see, we have a range of both medical professionals and non-medical professionals.